So today we'll be talking about hypertension. Now, as the title says, it's a silent killer. Now, there's a reason why it's called a silent killer. The reason is you can't see it, or you can't feel it, and you may not have heard of it, but it's there, it's everywhere, and it can affect you. And unfortunately, sometimes the first symptom could be a heart attack, a stroke, or even death. So it's something that we need to watch out for. So it's a deadly disease, and we have to control it before it strikes us. Now, how big is the problem? So let's see. So one of the things about this is the most common cause of premature death across the world. And within US, 1 in 3 adults have hypertension, that is 31%. And we treat around 65 million Americans for hypertension. So that's a lot. The next question is, how does hypertension affect us? Okay? So what we need to realize is it's a systemic disease. Okay? So when I say systemic disease, it can affect any part of the body. But today, we'll concentrate on 4 or 5 important places where it can affect. These include blood vessels, heart, brain, kidneys, and eyes. Now, the way it affects is it affects your blood vessels, the small blood vessels that supply the important organs. So usually your blood vessel is elastic and expands and contracts. So that's a good blood vessel. But what happens with high blood pressure is by constant pressure on your vessel, it damages it. It causes scarring in it, and it causes it to become tight, like stiff, like a lead pipe. And it can also cause to develop atherosclerosis, which is essentially the fat deposition, the white layer that you see there. It can predispose you to develop atherosclerosis. Now, once you develop atherosclerosis, your artery again becomes tight, and sometimes if the atherosclerosis, which is the fat or the plaque that builds up in the vessel, if it becomes too tight, then it can cause blockage of the blood supply to the heart or any other organ that it's supplying. So if the heart has to pump against this narrowed blood vessel, the heart is a muscle, remember that. It's a muscle, it hypertrophies, it becomes big. Now, this is not a good big. If it becomes big and if it stops, it still uses a lot of pressure to contract against this contracted vessel. At some point, it's going to become weak and enlarge. And it will not be able to pump the blood the way it used to before. And some of the blood starts pooling up in its chambers. And that leads to what's called a dangerous situation called congestive heart failure, where the heart can no longer pump out all the blood in its chambers. And that's when you feel suffocated. That's when the blood pools up in the lungs. And the next organ that could be affected is the brain. Now, it's the same mechanism. It's the blood vessels that are supplying the brain, the buildup of atherosclerosis, the vessels become narrow, and thereby decreasing the blood supply to the brain. If it's severe enough, it causes blockage. And sometimes if the blood pressure is too high, it can cause rupture, leading to bleeding into the brain. So high blood pressure is a major cause of stroke and bleeding in the brain. So it's a pretty dangerous disease. And the other thing is it can affect the normal brain function. It can lead to dementia, forgetfulness. Now, the other organ that it can affect is the kidneys. So when it affects the blood vessels that are supplying the kidneys, it can damage the kidney, all right? And the kidney can lose its ability to function, sometimes leading to dialysis. Now, the next organ that's of vital importance is the eye. So it may affect the retina. That's where you get your visual impulses in the eye, and that's how you're able to see. So hypertension can affect it by narrowing the blood vessels, rupturing them, or causing bleeding into them. If it's long-standing, and if it's there for a long time, it can lead to blindness. So a person who has a high blood pressure for many years is at risk of heart attack if the blood vessels are narrow, stroke, kidney failure. Now, if this is left untreated for long periods of time, it is pretty dramatic in how it can affect your heart. 3 times more likely to have heart disease, 6 times, now remember those numbers, 6 times more likely to develop congestive heart failure, and 7 times more likely to have a stroke. So those could be detrimental to your life. So now, the next question is, who is at risk? Who can be more affected by this? I have listed here like 10 conditions, out of which the top one is age. Advancing age is a major risk factor. And I'll list another 9 conditions here. Family history, smoking, alcohol, obesity, salt intake, stress, absence of physical activity, medical conditions, some medical conditions can predispose, like kidney disease, diabetes, things like that. And some medications can also cause hypertension. So we'll go through each one of them. The first one is obviously age. As I said, sometimes we don't understand how important age is in terms of causing blood pressure, but it's one of the biggest factors for high blood pressure. You'll see why. Now, after the age of 40, 37%, that is more than 1 in 3, have high blood pressure. And after the age of 60, 70%, that is 2 in 3 have blood pressure. Now, if you are age of 40 and if you have blood pressure, that is not your fault. Your odds are against you, but it is your responsibility to fix it right away.
Okay.
Now,
Okay.
the next thing is genetics and family history. If you have a family history, again, you can say, that's not my fault. That's what I was born with. But you can take action today to help prevent any future complications because you are more predisposed to hypertension. Now, the third one is smoking. Now, you guys all know about smoking. It's harmful. There's no benefits from smoking. So for whoever smokes here, the only thing I can say is stop smoking. There's nothing else for me to add there. And the next thing is alcohol. Now, in moderation, alcohol is okay, especially red wine. Now, if you drink in large amounts, it can cause damage to the heart, arteries, and liver. So essentially, it's acidic and it's toxic. So it's generally bad for your body. So try to avoid excess of alcohol. The next thing is obesity or overweight. Now, just like smoking, there is no benefits from being overweight. So, and the other thing is lose it now, because the older you get, the more difficult it is to lose it. The next thing is sodium. Oh, let me go back here. Actually, so sodium, again, no benefits. You get fine sodium in the table salt or processed food. So try to minimize on the sodium. So the other risk factor is stress. Now, we all know stress is bad, but what can we do about it? You can't get rid of it. What's important is the meaning you give to stressful situations, because you absolutely cannot get rid of it, but how you deal with it matters. If you freak out, get negative, and focus on the problem, the entire time, you are under extra stress. That's not useful. So it's best to focus on solution and to know that this too shall pass. And worrying about the problem isn't going to help you in any way. So that's how you deal with stress. Try to focus on the solution. The next is, and that can affect your blood pressure and heart. Now, lack of physical activity. This is a major problem, okay? We all know that we sit too much, but just getting outside, walking like 20 minutes a day will be very useful to your physical health as well as mental health. The next condition is medical conditions. Some of the medical conditions make you very predisposed to hypertension. So, and especially if you have a genetic history or a family history of hypertension, you need to pay special attention to take care of it. Must make changes to your lifestyle, because your body is more sensitive, you're more predisposed than an average person. Next, some medications that we as physicians prescribe can sometimes be causing more harm in terms of hypertension. It may cause hypertension, like steroids, cyclosporin. There are a few medications that can cause hypertension. So if you're one of those on those medications that can cause hypertension, if your blood pressure is not getting controlled well, you need to talk to your doctor and say, like, is any of my medications causing hypertension? So these are the 10 things that if you have any of these, you're at higher risk for hypertension. Now, what is high blood pressure? Okay. Now, luckily, it's easy to measure. But the way it has to be done is you have to go to a doctor or get to some place where they can check a blood pressure. And it's easy. You go to the doctor, and the first thing almost any doctor does is check a blood pressure. So you just need to make that attempt. If you're not going to doctor, there are other places, like here today. It can be screened for. You can go to Walmart. You can get screened for. So it's easy to get the blood pressure recorded. Now, the important number, if you have to remember something today before leaving here, the important number to remember, and all of you have to remember this number, 120 or 80. The top number is called systolic blood pressure. The bottom number is diastolic blood pressure. It's 120 or 80. That's a normal blood pressure. Anything at that level is optimal. Okay? Sometimes less than that is okay. But 120 over 80 is optimal. Now, if you go to your doctor, and if you're one of those lucky people who have normal blood pressure, that's great. But that does not get you off the hook. This can soon change if you don't monitor it. So at least, even if you have normal blood pressure, you need to keep checking it at least 2 times a year so that you can catch it before it affects you. So now if you leave it for a long time, you know, age is a major risk factor. If you're aging, your blood pressure might go up. So if you reach 140 over 90, which is not too much from 120 or 80, it's only 20 points on the top number, 10 points on the bottom number. If you reach 140 over 90, now that's called hypertension. That's when your doctor has to act. They need to do something to get it down. If you have the blood pressure, if you're diagnosed with hypertension, is it all downhill from there on? No, it's not. If you are diagnosed with high blood pressure, if you lower it, you can still control what happens with you. So for the stroke incidence, average % reduction, if you have stroke, the chance of having a stroke, if you control your blood pressure, you can cut it down by 35 to 40%. That's a big number. Heart attack or MI, myocardial infarction, from 20 to 25%. That's again a big number. Now heart failure, 50% if you control your blood pressure well. You can control your blood pressure, bring it down, and you will cut down your risk of heart failure by 50%. So those are good numbers to work for. Now this is a very impressive slide. So what it shows is your risk of dying. If you decrease your blood pressure by 2 millimeters, it's not a lot, just 2 millimeters from 140 to 138 or 170 to 168, you can make a difference to yourself. You can decrease the risk of heart disease by 4 to 7%, stroke around 4 to 10%, heart failure 5 to 7%. So that's for a 2 millimeter mercury drop. That's a good numbers to have. Okay, so it's all worthwhile to get your blood pressure down as much as you can. Now, the next question is, how do we get our blood pressure down? So the important factors, I mean, almost always the answer is by lifestyle changes. You need to change or modify the way you live. So the first thing is obviously salt intake. Now that's pretty generous, 5 to 6 grams per day. But usually I would say to my patients, 1 teaspoon for the entire day. So which is usually like 2.5 grams, okay? So less than that. So 5 to 6 is a little generous, but that's what they recommend. But usually if you have heart failure or anything like that on top of it, 2.5 grams per day, a teaspoon of salt. Now, alcohol intake, it's okay, as long as it's in moderation. So the limit is for men, 20 to 30 grams. For women, 10 to 20 grams. Now, what is 20 to 30 grams? So 10 grams is like 1 beer, okay? 10 grams is like 30 cc's of whiskey. Now, 10 grams is like 100 cc's of wine. That is 10 grams. So men are allowed around 2 drinks or 3 drinks, women 1 to 2, okay? So that's the limit. Now, increase vegetables, fruit, and low-fat dairy intake. So by increasing the vegetables and fruits, it's called like more like Mediterranean diet or a DASH diet. DASH is nothing but dietary approaches to stopping hypertension. So you increase your vegetable content. So when I talk about vegetables, I'm saying essentially at least 4 servings of vegetables. Serving is a cup. 4 servings of vegetable in a day. Okay, same thing with the fruits, 4 servings of fruit in a day. So that's essentially what is recommended by American Heart Association. So now, the next thing is you need to watch your weight. BMI. What is our goal? 25 kgs per meter square. That's the number that we need to remember. And waist circumference. And how do you measure it? Right about the level of the umbilicus. So for men, the girth should be less than 40 inches. For women, 34 inches. Now, exercise goals. You have to do exercise 30 minutes per day for most days of the week. That is, at least 5 days in a week. You have to exercise for 30 to 40 minutes. Again, this is per American Heart Association. Now, the last thing is quit smoking if you're one of those who smoke. So what happens with lifestyle modification? Again, these are impressive numbers. Look at the weight reduction. If you lose 1 pound, you lose 1 millimeter of mercury. So when instead of 10 kgs, if I say 20 pounds, then for every pound that you lose 1 millimeter of mercury. So if you lose 20 pounds, your blood pressure is down by 20 millimeters of mercury. Now, by adopting DASH diet, which is again, it consists of fruits, vegetables, and low dairy fat, it decreases your blood pressure almost 10 millimeters mercury. Look at the sodium. If you decrease your sodium content, you'll get 2 to 8 millimeter mercury decrease. Physical activity, again, close to 10 millimeters drop in mercury in your blood pressure. And by taking alcohol in moderation, around 5 millimeter drop in mercury. So these are all impressive numbers. Now, if you do all of this, it's not like you will get 60 millimeter drop in mercury. They're not additive like that, but they do, you gain like 20 or 25 millimeter drop in mercury if you do all of this. All right? And this is my final slide. So if you do all of that, most of the patients will experience better control with diet and exercise. Now, physician's advice, like sometimes when we give advice, it works, sometimes. But what's important is we should always give you a follow-up so that we can keep a close eye on this blood pressure and lifestyle changes. So, and the other thing that we don't do a good job at is we don't spend much of the time when you come to us on counseling on lifestyle changes. Beyond simple advice and admonishment, we don't do a lot. So, and usually we use time as an excuse, but that's not a good excuse. We should do, as physicians, we should be doing a better job at educating folks when they come to us. Nevertheless, lifestyle modification is the top of the JNC, Joint National Commission 7 guidelines. It's always the lifestyle modification that gets you good bang for the buck. If you do any of those things that I just mentioned, your blood pressure would be under decent control. And after that, if it's not controlled, you always have your doctor to talk to and get you in a better control. All right? Thank you all.